Good morning. My name is Jennifer Botsford, and as the Acting Office Chief of the Office of Environmental Health here at the Arizona Department of Health Services, it is my privilege to welcome you to the 2020 Virtual Sanitarian Conference. As many of you know, our Food Safety and Environmental Services program is dedicated to overseeing food safety and environmental sanitation monitoring and regulatory activities in the state of Arizona. The sanitarians of our state provide a vital service for diverse environmental issues such as food safety, water quality, wastewater, and new emerging threats. In order to reach our goals, we offer this annual conference as an opportunity for registered sanitarians in our state to earn 12 hours of continuing education. I'd like to take a moment to give a sincere thank you to the Planning Committee, Eddie Valerio, Heather Miller, Margot Dittmar, Shauna Kong, Tom Wilson, and Yvonne Namey. We have a great team here who has worked very hard to offer you a wonderful selection of speakers and to adapt to the times by embracing new technology to ensure this opportunity is available this year to the Arizona community. I would also like to thank our speakers for their time and sharing their knowledge and experience with us. I'm looking forward to hearing the talks this week, as we are so fortunate to have with us individuals who are respected leaders in their field. They will cover a wide variety of topics. Hopefully you all will find interesting and engaging. I'm sure many of you have been inundated with the COVID-19 response, in addition to your regular work, and you will see some talks reflect this as well. I would also like to thank you, our audience, for taking time out of your busy work lives to join us today. I would like to take a few moments to go over a few housekeeping things and then provide some program updates. We have a couple of scheduled breaks today, as well as a lunch break. The agenda was sent to registered attendees to the email that they registered. It is also posted online on the Sanitarians Council website. You can go to www.azdhs.gov/SANconference. That's SANCONFERENCE, and click on 2020 Virtual Sanitarians Conference agenda. This presentation will be recorded. For those that approved, the speaker's presentations will be posted on our website for public viewing. Please disable your video and microphone so attention remains on the speaker. We may also mute people if we hear background noise. We very much appreciate any feedback you provide on your experience over the next 2 days. Only individuals that complete and submit both feedback forms will receive an attendance certificate via email. We will not be announcing at what point the link to the feedback survey will be provided. It's a surprise, but the link will be shared with the group via the Zoom chat. If you are viewing the recorded presentation on our website, please contact sancouncil@azdhs.gov if you are in need of an attendance certificate. If you have any questions about Zoom functionality during the conference, either send a message through the group chat or a private chat with Shauna Kong. If you have questions for the speakers, please hold until the end of the presentation, as speakers will be available for live questions. Please submit your questions through the group chat. We will also be conducting live polling questions throughout the conference. Participation is optional, but highly recommended. Please visit www.sli.do, and then you can enter the event code, which is SANCONF, SANCONF. So next, I will switch gears and give you an overview of the Office of Environmental Health and some of the highlights from the past year. As many of you know, the Office of Environmental Health is part of the Bureau of Epidemiology and Disease Control here at the Arizona Department of Health Services. In our office, we have several programs and multiple grants funding sources within each program area. We have Food Safety and Environmental Services, Smoke-Free Arizona, Sunwise program, childhood lead poisoning prevention, environmental health public tracking, environmental health capacity, environmental toxicology, drinking water, and the climate and health programs. Currently, we have 5 sanitarians on the Food Safety and Environmental Services team. We have Heather Miller, Margot Dittmar, Shauna Kong, Eddie Valerio, and Yvonne Namey. We're in the process of recruiting the program manager. We are also in the process of hiring the permanent environmental health office chief. If you're interested in learning more about the open jobs here at ADHS or other state agencies, you can visit https://hr.az.gov/az-state-jobs. We have a few office updates we would like to share with you. First off, in regards to the Arizona Sanitarians Council, there were some rule changes in regards to the computer-based exams. This process has been updated too. First, the applicant should complete the application to sit for the exam to the Arizona Sanitarians Council. Then, the Sanitarians Council will review the applications quarterly, make an eligibility determination, and notify the applicants. Third, approved applicants will pay a NEHA exam fee. Fourth, the applicant receives an email with the ID code and instructions from Pearson VUE, who is the third-party vendor and administers the NEHA exam in Arizona. Fifth, the applicant schedules the exam through Pearson VUE to take the exam within 6 months of the council's approval. Sixth, the applicant prepares for the exam. Seventh, they take the exam and receive immediate results. And finally, if needed, they can retake the exam within 12 months of the Arizona Sanitarians Council approval by returning to step 3. I want to take a moment to draw your attention to our group emails. This is really the best way to reach staff. All staff associated with a particular program area have access to the group emails. So even if staff are away from their desks or off for the day, you are able to reach someone on duty. Also, this helps us keep track of questions that were previously asked and answered. Arizona's Cottage food program allows individuals to make homemade products that are neither potentially hazardous nor time or temperature controlled for safety, also known as TCS foods, and offer them for commercial sale. Arizona residents are required by statute to register for the Arizona Cottage food program in order to prepare food products in a kitchen of a private home for commercial purposes. To register for the Arizona Cottage food program, food preparers must be interested in making approved foods that are not potentially hazardous or time or temperature control for safety foods, complete a food handler training course from an accredited program, and maintain active certification. As of November 1st, we have over 10,500 registrants with the Cottage food program. We have seen a major uptick in registration and questions since March and April of this year, most likely due to folks staying home because of COVID. We have also seen an increase in complaints. The most common complaints are unregistered sellers, selling unallowed products, and labeling issues. The label must include the common name of the product, such as chocolate chip cookies, the name of the registered food preparer, and the registration number, along with their contact information, such as their phone number and or email address. The label must also include a list of ingredients and the following statement exactly as written on this slide. This product was prepared in a home kitchen that may process common food allergens and is not subject to public health inspection. The label must also include the production date. The Arizona Department of Health Services School Garden Program offers free certification for school and community gardens. Certification makes it easy and safe to bring your garden produce into the school cafeteria or the community. Certified gardens implement best practices for growing and harvesting fruits and vegetables so that foods grown are safe to eat and serve. The benefits to students and staff include teaching sustainability, plant care, harvesting, life skills, math and science skills, nutrition, and it increases exercises and the likelihood of trying new foods. At the heart of certification is a food safety plan. Each garden seeking certification will customize their own food safety plan that outlines the policies and procedures the garden will follow, taking into account best practices in the school garden program guidelines. The school garden program helps applicants along the way, from providing a customizable food safety plan template to a guidance document that will help you write comprehensive policies and procedures, to an in-person site visit. Learn more about the program by visiting our website. Over the last year, the program provided a food safety training for master gardeners, contributed to the publication Success with School and Community Gardens, and awarded over 60 certifications for school and community gardens. You'll hear some more updates on food safety from Eddie Valerio, who is the next speaker after me. But next, I will move on to the Environmental Public Health Tracking Program. The purpose of the Environmental Public Health Tracking Program is to deliver information and data to help residents learn about and protect themselves from health issues arising from or directly related to environmental factors. Our program is part of a national network with this shared goal. The Arizona Environmental Public Health Tracking Explorer is a system of integrated health, exposure, and hazard information from a variety of national, state, and local sources. On the Explorer, you can view maps, tables, and charts of health conditions and environmental hazards where you live, work, or visit. This year, the team has been working hard to add data to the Data Explorer, and it now has more than 3.6 million rows of data and 400 measures. Staff have also been assisting with the Health Emergency Operations Center with the COVID-19 response. EPHT has provided expertise and support to the agency's COVID-19 response in the development of web applications such as the ADHS COVID-19 dashboard, cases by zip code map, funeral home tracker, and post-acute care tracker, as well as epidemiologic support in the surveillance of COVID-19 cases. Tomorrow you will hear more about this program from Nikki. This year we were awarded a 5-year grant to strengthen our environmental health capacity. Our focus areas are to improve pesticide and adult lead poisoning surveillance, as well as provide free private well water testing. ADHS will build core capacity and to use environmental health data. Much of the environmental-related disease burden is preventable if good quality data is available for planning and implementing health policy. During the 5-year award period, the Environmental Health Capacity Program will enhance adult lead and pesticide exposure surveillance. ADHS is also focusing on improving access to safe drinking water from private wells. The majority of Arizona's infrastructure, in particular public water systems, serve primarily urban and suburban areas, leaving rural residents relying on over 100,000 private wells, according to the Arizona Department of Water Resources. This program will test private well water to help protect the health and well-being of underserved Arizonans that rely on unregulated private wells and other small drinking water systems. Arizona's climate is prone to extreme weather hazards. During the summer, Some areas of the state are exposed to more than 120 days of extreme heat over 100 degrees Fahrenheit. Severe storms during monsoon can lead to instances of flash flooding. Prolonged drought conditions promotes wildfires and poor air quality. Winter months can lead to freezing temperatures and snowstorms. These hazards can impact public health. The Extreme Weather and Public Health Program provides resources for individuals, families, and organizations to plan before, during, and after events such as heat waves, wildfire, flood, extreme cold, and poor air quality days. This year, the Climate and Health Program provided guidance to local governments on COVID-19 safety, precautions for heat interventions such as cooling center operations, and distributed bilingual heat safety brochures to outdoor COVID-19 testing sites for staff and patients. However, unfortunately, due to COVID-19 response, the 2020 state heat meeting was canceled. The Office of Environmental Health had a grant to offer free drinking water for the past 4 years. This funding also allowed the drinking water team to develop a pretty thorough website, which includes information about testing the wells, rules and regulations, emergencies, how to maintain wells, private well data, and other resources. Current knowledge about Arizona's groundwater quality indicates that well owners should test at a minimum arsenic, uranium, fluoride, nitrates, and bacteria. These recommendations are based on Arizona Department of Environmental Quality's ambient groundwater monitoring program, which sampled from 31 different basins across Arizona. This year, the drinking water team developed a social media campaign to promote well water testing. The campaign has reached about 500,000 people in September, and the free well water education workshops came to an end after 4 years. However, there is a recording available on our website at azdhs.gov/wellwater. Lead is a metal found naturally in the environment and has been used in many products, including paint and gasoline. People can become exposed to lead by swallowing or breathing in lead dust, which causes lead poisoning. When lead gets into the body, it can be harmful and cause irreversible effects. Young children are at greater risk for lead poisoning because they put everything in their mouths and absorb lead easily into their bodies. Young children are also more vulnerable to the effects of lead poisoning because their bodies are still developing. Even at low levels, children's hearing, growth, and intelligence can suffer irreversible damage. Pregnant women can also pass lead to their unborn baby. The program recommends that all children should be evaluated for the risk of lead poisoning at 12 and 24 months of age. The Childhood Lead Poisoning Prevention Program posted the 2018 annual surveillance report on the webpage, and they're currently working on the 2019 report. This year, the program developed a healthcare provider training with Phoenix Children's Hospital, and this training is available online. They also received funding to test charter schools for the drinking fountains in charter schools for lead. In 2020, the Smoke-Free Arizona program completed the county assessments, which are scheduled to occur every 2 years. The assessments are intended to provide counties with a platform to showcase their educational outreach efforts, share experiences, highlight strengths, discuss difficult inspections, seek guidance, and detail enforcement practices. In 2020, the Sunwise Skin Cancer Prevention Program collaborated with the Arizona Department of Health Services Comprehensive Cancer Control Program to create a training video, which will provide the viewer information and sun safety strategies to protect themselves from overexposure to the sun. This collaboration also led to the creation of a teacher's guidebook. Given the COVID-19 pandemic, the program has prepared for more virtual presentations in the future. Teachers will be able to use this guidebook to teach their students sun safety and skin cancer prevention. Thank you for your attention, and I hope you enjoy the next 2 days.